Hello, everyone. I'm Daniela Leite, the Business Director here at the Brasil-Canada Chamber of Commerce. It's a pleasure to have everyone here together. Today, we're going to have the Patient Experience webinar, a webinar that is organized within the framework of the CCBC Innovation Health Commission, which is an important space for discussion on the most relevant topics related to healthcare innovation in order to exchange experience, talk about better improvements, trends, and so on. I use this opportunity to introduce our two chairmen here with us, chairman of our healthcare commission, Ricardo Meirelles and Luis Sergio. Thank you so much. Thank you for supporting us and helping us with this very relevant commission. And a special thank you today to Ricardo that put this event together, introduced and put us in contact with these relevant companies that are with us. Thank you for the representatives of Hospital Pequeno Príncipe Hospital, Twin the Care, and Sick Kids. For sure, we're going to have relevant discussion today and bring more information for everybody that is with us. I would like to just emphasize that this year is a very important year for the Chamber. This year, the Chamber of Commerce will complete 50 years, and we're going to have very relevant events throughout the year. The Forum, Economic Forum, Canada Day, Brazil-Canada Summit. So please check our social medias and be with us. It's going to be a pleasure to give even more information and work together to foster business between the two countries. Also, this year, we're going to have a trade mission related to healthcare in October, where we will take Brazilian executives to Canada in order to exchange information, work together, and introduce the great scenario that Canada has to offer and to share with us too. So for more information, our team is here ready to give more detailed information. For questions, just a reminder, please use the chat and I will coordinate with Ricardo that is here and you're gonna use in the end of the discussion. So thank you again. I will give the floor, the virtual floor to Ricardo. The stage is yours, Ricardo. Good afternoon. How are you?
Good afternoon, Daniela. Thank you so much. It's a great pleasure for me to be here today to talk about this growing topic, patient experience, which is really how patients interact with the healthcare system and healthcare resources, and how this interaction has changed in the last few years. Patients now demand more information, better quality of care, personalized care, and so many things that they didn't have years before. And here we have three leading organizations that are going to share with us what they are doing to streamline process, create new programs, and leverage cutting-edge technology to address this demand that patients are asking. I would like the members that are here in the panel to introduce themselves today. We have Sick Kids Hospital, we have Pequeno Príncipe Hospital, and we have a leading technology company, Twin the Care. So please, members of Sick Kids, I would like you guys to introduce yourself and give a quick overview of your organization, if possible.
Thanks, Ricardo. I'll kick us off. I'm Cindy Bruce Barrett, and I'm the Director of International Affairs in the International Patient Program. And before I give a little bit of background about our organization, I'll just have my colleagues from Sick Kids introduce themselves. Greg?
Good afternoon, everyone. My name is Greg Kennedy. I'm the Director of Strategy at Sick Kids and have been quite involved over the last few years in developing and implementing a virtual care strategy, which has a heavy impact on patient experience. So looking forward to talking a lot about that today and learning from all of you. Thanks for having us. John?
Hey, everybody. My name is John Nashid. I'm a Senior Project Manager at Sick Kids, and I work with Greg on the strategy portfolio as well. We've worked extensively over the past couple of years to bring forward several initiatives that are helping improve the patient experience. So we're looking forward to sharing that with you, and as well as learning from our colleagues in Brazil and anyone else who's attending today. So looking forward to it.
Thanks, John, and thanks, Greg. So just to give you a little context, Sick Kids is a hospital in Toronto, Ontario, Canada, and we're recognized as a leading pediatric tertiary quaternary level hospital. And we're Canada's top academic health science center that's really dedicated to advancing children's health. We also had the privilege of being recognized by Newsweek in 2022 as the world's top pediatric health center. We have a long history dating back to about 1875 and of really contributing to international research, innovation, and the patient care agenda, of course, to really focus on improving health outcomes for children and youth. As a pioneer in scientific and clinical advancements, we're also a teaching hospital, and we're affiliated with the University of Toronto. And we continue to attract and retain world-renowned scientists, educators, administrators, and clinicians to really drive our high-quality, accessible, comprehensive, and sustainable child health system. For well over a decade, Sick Kids has really provided capacity building, advisory, and education services to large and small scale projects internationally. And we've had a number of projects in Europe, South Africa, China, India, and the Middle East. And we're really driven to seek sustainable solutions by working with other clients and other governments across the world to really facilitate the development of the child and youth healthcare agenda worldwide. Core to our success is really looking at integrating quality improvement and innovation. And Greg and John will be talking a little bit more throughout the course of this panel and sharing with you some of the strategies around how we've been able to bring that innovation to light, always with a safety and always with a quality lens, but really how do we leverage technology and perhaps share some of our lessons learned with the other panelists and with the audience at large today. So really thank you for inviting us to this webinar, and we really look forward to the discussion today.
Thank you so much, Cindy. Appreciate. Dr. Rafaela, would you like to introduce yourself?
Sure. Thank you, Ricardo, for the invitation. I'm very happy to be here, very honored. My name is Rafaela, I'm a pediatrician, and I'm the head of the telehealth department at Hospital Pequeno Príncipe. I'm going to talk a little bit about our hospital, our complex. We're actually a complex. And then I'm just anxious to share our experience and hear from you guys from Sick Kids. So our motto is every child has the right to a healthy and happy life. We are a complex that is constituted of a world-class hospital, a college for health professionals that is called Pequeno Príncipe College, and a research institute that is called Pelé Pequeno Príncipe Institute. So it has the name of the famous footballer that was our sponsor and was a great contributor to the cause of the research in child diseases. So all these arms of the complex are working together for the health and well-being of children and adolescents. We are a complex located in Curitiba. We are at the very south of Brazil. And in 2022, we completed 103 years of existence. And we were also thrived to be recognized by the Newsweek as one of the top hospitals in the world. We are currently at the 87th position. And we see ourselves as a global player in finding cure for childhood diseases and advocate for child-friendly medical care. We're also a cradle for pediatrics in our state in Brazil. We're responsible for training specialists in different specialties for over 4 decades. So more than 2,000 pediatricians, anesthesiologists, orthopedists, and pediatric surgeons from different regions of the country, for example, have already completed their training and completed internships and residencies at our institution. Since 2013, we have been investing in telehealth initiatives, mainly through teleconsultancy programs between our ICUs and some top-ranked ICUs worldwide. And 2 years ago, we have officially created our innovation office and our telehealth department, which I work for currently. So It's an honor to be here. Thank you for the opportunity. I hope to be a contributor to this webinar.
For sure. Thank you so much, Dr. Rafaela. And Dr. Anna from Twinda Care, we'd love to hear from you.
Hi, everyone. Good evening. It's an honor to participate in this webinar. My name is Dr. Anna. I am a pediatrician and chief medical officer at Twinda Care. Twinda Care is a Brazilian startup that works with healthcare innovation in Brazil.
Great. Fantastic. So guys, thank you so much. I would like to start here the discussion with a topic that everybody wants to see is really the contrasts between Brazil and Canada related to patient experience. But I think we could start talking about what do you see in terms of the culture, the mindset on this area. I think everything that changes and transforms sometimes have a resistance. So I would like you guys to share with us what you see in terms of the culture, the mindset of people in adopting technology to improve the quality of care, and how you guys overcame challenges in this area, which programs, which ideas, how you help people to embrace more innovation. And there are other factors as well. If you see other factors that help to this, for instance, COVID, that push technology and the adoption of technology, and other things that also help in this journey to change the mindset, to make people more open to change, to transformation, and to technology. So Sick Kids team would like to start sharing some thoughts on that.
Sure, thanks, Ricardo, and happy to start things off. I will certainly bend my comments a bit more to Canada and to the virtual care technologies that support patient experience, because that's what I know best. But when I'm thinking about Canada and Brazil, something that's just a really good news story is, compared to what it was historically, the patient experience just matters a lot more now. I think at least in Canada, historically, we were not very customer centered. If we're thinking, at Sick Kids, that's children and families that we serve. We're a big downtown hospital. Sometimes it's inconvenient to get to us, fighting through traffic and paying for parking and waiting in waiting rooms for providers. And some of the new digital technologies really help us to put the customer at the center of the services we deliver, and to learn from and implement what's happened in other sectors that are just further ahead of us: retail, electronic, tech companies, communications. So I think there's a big shift there in Canada towards being more patient-centered, which probably helps with all of the work that follows. Another thing, just comparing our two countries, is geography. So we're both very big countries with populations that cluster around urban centers. I had the great pleasure of visiting Brazil for about a month in 2012, and can attest there were some very long bus rides going from north to south and east to west. So, just like Canada, a huge country, but our population, although much smaller, does cluster around urban centers. And some of these digital technologies can really help us in a number of ways to extending our services, whether that's upstream in a preventive way, through things like with remote patient monitoring, whether that's extending specialized healthcare services to some of the more rural populations, or after people have had an engagement with our hospital, to getting them home a little quicker and making sure they're safely cared for through the technologies. And probably just a final statement is COVID. It's been the great accelerator for all its fault. It's been the greatest assist we could have hoped for virtual care and some of these digital technologies. So just great timing right now to lock in some of those gains and scale them up for a better future.
Fantastic. Thank you so much. Any other comments from the Sick Kids team? So, Dr. Rafaela, any comments on that? Want to share with us?
Of course, Ricardo. I think pandemic was the wave and we surfed it, right?
Yes.
I think through the pandemic, Brazilian medical institutions faced the rise of the necessity of quality remote care. And unfortunately, in my perception, we were short-handed, you know. And it was sad and it was done. We did it. We accelerated. We did it. We did our best. But the pandemic made us accelerate implementation, the regulatory basis for telehealth to thrive. But it also showed us how we should have thought ahead a little bit more, I think, to implement technology with more structure and more responsibility. So we are now learning about our mistakes and learning about the things we had to do to make it work quick, fast, and now we are trying to regularize it. So for sure, it is worse not to do, but it is hard to do in a nice way without experience and a proper regulatory strategy. So we were very lost at the beginning of the pandemic. That's my perception. And up until this point, everything is very recent and very heterogeneous. So if we talk about law, our general telehealth law is dated December 2022. Like we had previous laws and normatives, but they were very evasive and very restrictive towards telehealth. And besides some very relevant work in telehealth, especially in academic specialized centers, our first proper national digital strategy protocol from the Ministry of Health is dated 2020. It's a very nice plan of 8 years of implementation. So, but it's dated 2020, so it's very recent. So this year, our elected government has created a special secretary aiming towards regulation of digital health. And it's a very good prospect. We are looking to a very good prospect. But on the other hand, and now we are talking about accessibility and parking and about how some of our patients have to like drive hundreds of kilometers to reach our centers. But in Brazil, we have over 30 million people that do not have access to internet. So in numerous institutions, they're still adapting to digital records, right? And we have a lot of different medical record systems and telemedicine platforms without interconnectivity. So we are thrilled, but we need to talk about it, right? We need to make it right. We need to really give access, because technology is amazing, but it can enlarge the gap between the ones that are very vulnerable and the ones that have access to everything. So I think doctors and health care providers overall are still trying to grasp the potentiality of telehealth and its safe uses. And when confronted with new devices and digital workflows, some may be like rightfully suspicious or just skeptic for no reason, and I think the solution for that is the construction of a critical, productive mindset. Clinicians, nurses, and students from health areas must be rightfully educated. So we are working with a lot of education, in our college, in our institution. So for me, both myths regarding telehealth, that is a complete solution, a panacea, something that is going to solve everything, or that is a lesson too. They are way too simplistic to define it. It's powerful. It's a powerful method when adequately, intelligently applied. It is a possible way to achieve accessibility, but it must come like coated with bioethics, reasoning, and good technical knowledge. So I think just to close this introduction and not to take more time from you guys, it is thrilling to see a new generation of doctors and healthcare workers that can assimilate technology. And it is a very nice new generation. But I think we need to guide them towards its better use and to think technology and overall IA, IoT devices, softwares with ethics, with responsibility, what is applicable to the overall market may not be applicable to the market of health, and medicine and other health areas are sciences, and digital health must be scientific, must be educational, must be technically adequate. That's how I see it. That's how we see it here in Pequeno Príncipe.
Oh, that's fantastic. And also I like the point of the new generation was something that I was going to raise, how new generations of healthcare professionals are adopting more technology. We can discuss further, but I would like to have Dr. Ana also, since she's a technology provider, how she's seeing this resistance or adoption throughout these last years and how technology is playing a part on that.
2020 was a challenging year for healthcare workers with increases on demand, complexity, and cost skill gaps. In the beginning of pandemic, like Dr. Rafaela says, the telehealth in Brazil wasn't regulated. Just in the end of 2022, the law was approved. And like a good hype cycle, in the beginning, healthcare providers and the population had a great adoption. In the other hand, after the peak of inflated expectation during the end of the lockdown, we observed a reduce on the engagement at telehealth solutions. In the middle of previous year, we initiated a slope of enlightenment with organization of healthcare workforce and reduce cost skill gaps between traditional care. It's important to mention that Brazil is a huge country with several limitations to specialized professional, for example. And about mindset, we need a mindset change, a mind change with C-level to invest in infrastructure and training of IT system, for example. We need to change the way of work. We cannot still work in silos. We need to work in a centric way.
Excellent point, Dr. Ana. So I would like, since your organizations are really facing this challenging and finding solutions and creating a new process and new initiatives, correct? Perhaps we could discuss some of these technology initiatives that SickKids, Pequeno Príncipe, and Twinder Care is supporting here to show to the audience how you guys are finding the solutions to provide a better patient experience overall. SickKids team would like to share some innovation that you guys have implemented.
Sure, and I think maybe where we'll take that one is just talking about starting kind of zooming out and talking about our overall philosophy with respect to technology. It's sexy to talk about these cutting edge new solutions, and so conversations often gravitate there, but something that we've tried to keep front and center as a guiding principle when we're thinking about technology is that it should be secondary to what, in our environment, the patient care need is. So we always try when we see a problem or an opportunity to bring all the right stakeholders together and really clearly understand what that problem or opportunity is. And important to have patients and families at the table, providers at the table and doing that. And only when we have that very clear understanding, going and looking at what are the available technologies that can help us to meet that need. So that's the order of events that we try and apply when thinking about technologies. And then, we're talking a lot, and we're going to talk a lot about virtual care today. But zooming out again, we try and think about that within the context of a very comprehensive digital strategy for the organization. So there's digital technologies that we're going to be working with in the virtual care space. There's data and artificial intelligence. There's a lot of technologies that are going to support our sort of back office operation. And when we think about that, we parcel out those technologies with our patient facing, and that will directly impact the patient experience, and think about those in a comprehensive way. This is an important point especially for organizations who might be earlier in their digital transformation journeys. For years, we had what we sometimes describe as a let the flowers bloom approach, which means everyone who had a pet project or a solution or a very narrow patient population they had very good intentions to solve for or serve, went out and got a point solution from a vendor that solves a narrow need. And you end up with this huge proliferation of those over the years. And in our current state now, what we're trying to do is think about all those technologies that serve the patient experience and now streamline them or integrate them. Because each time you add a new point solution, you kind of fragment the patient experience if it's not done well. And with each point solution, you have licensing costs, maintenance costs, privacy, risk, legal, all of the above. So I think when organizations are thinking about the patient experience in virtual care, think about it in a platform-based approach. Who are those large vendors out there you may be able to partner with in long-term scalable partnerships who can meet a lot of your use cases, or who can create a platform where you integrate your technologies into a really seamless user experience, so that we don't have to ask patients to have multiple different apps and multiple different logins and multiple different learning curves. And that's sort of the reconciliation work we're doing a lot now at SickKids, coming from that proliferation of point solutions into a much more integrated digital experience.
That's fantastic. That's really great.
Just to add to that, what Greg and I do quite a bit of is we reach out to our key personnel, like Dr. Rafaela or Dr. Anna. We do a lot of communication, we do a lot of engagement, both with our clinician colleagues, as well as with the community. We reach out to both our parent councils, as well as our children's councils, to generate ideas and to kind of concept test how we can take some of the ideas that we've implemented, as well as some of the future ideas, and build a strategy that is going to change culture, not just change point solutions. Because we all know the cultural strategy. So we are always doing this engagement, this forward engagement with both the physicians, allied health nurses, as well as our community, to come up with the plans that are going to help us implement not just the best solutions, but the sustainable solutions that will get everybody's engagement.
That would be great. Yeah, great initiative. Other was Dr. Rafaela.
Nice, thank you, Greg and John. It's very interesting to hear it. I found that the solutions that we have been trying to implement that are more successful are the ones that can integrate with the routine from the clinicians and the patients in a way that they don't feel like they are overworked, flood with a lot of new assignments instead of something that is facilitating their routine. So it's very interesting to hear, and this preoccupation with a journey that is not filled with a lot of stops. You have 1,000 of apps, thousands of entries, and you don't have this unified digital center. It's something we have been worried about, and it's been challenging. And it's a little bit of what we talked. I talked in my initial statement. It's a word that we have, integration, how to make different systems work. We're still having baby steps in it. And to talk about what we are doing in telehealth and innovation, at Pequeno Príncipe Hospital, some years ago, one of our CEOs was in an innovation fair, and it came through a device that was an all-in-one physical examination device that is called Tidal Care. And so the hospital has been involved in all the regulatory bureaucracies and demands for the Brazilian national agencies to bring Tidal into our reality. And when we did it, we decided to align the use of the device with our premise of bringing technology and the devices to the healthcare scene with responsibility. So we conducted a non-randomized clinical trial with more than 690 children. And this trial was conducted with the Tidal device, and we basically compare the regular in-person physical examination with a tele-interconsultation between a physician and an untrained physician with the Tidal device, and we compared the parts of the physical examination, so the auscultation, the throat exam, the otoscopy, the heart and lung auscultations, and we try to find out if they were comparable, if they matched, if they have accuracy, and if it was safe, you know, to bring telemedicine with these devices to primary care centers, and or to discharge our patients with this device to a telemonitoring program. And we have recently published a very interesting study in JAMA Open Network. I will put the link in the chat if someone wants to read it, in February of this year. And I think for pediatrics, telemedicine is great, but we are the health professionals that miss physical examination the most, you know, because children are non-verbal mostly, or they are having someone that is talking through them. So when we read these studies and when we were like baby stepping telemedicine in our institution, I was always hearing physicians like, oh God, how I miss physical examination. And now I hear my physician saying, oh God, I love having Tidal because I can have the physical examination. So it's very interesting. And we have been applying the device in some very interesting settings. So we have the Tidal device and a trained nurse in primary care centers in peripheral regions of Brazil that they don't retain pediatric professionals as we wanted. And we have it even in an indigenous tribe. It's an urban indigenous tribe, but it's an indigenous tribe, and it works. It's interesting. It's accessible, and we are trying to have some of our lines of telemonitoring with the device too. So we have post bone marrow transplantations. Our patients, they can have a Tidal device for telemonitoring when they're going back to their homes at the north of the country. They're just post bone marrow transplantations. There are a lot of things that can happen in this time. They have doubts. They can develop some early complications that they can be detected very early and have like the right treatments. And we also have a telenurse line of care with Tidal for complex sores, for complex skin lesions that need to be telemonitored for a long time. So we can give patients an early discharge, and they can also be safe at home with our specialized nurses looking through to them like 2 or 3 times a week. So it's very, very interesting. But for me, it is very clear the necessity of a very active and engaged telehealth support team. We have to be constantly engaging providers, constantly reinforcing like digital etiquette and what are the best contexts to do telehealth with safety. So we have 2 nurses in our department that are responsible for like constant follow-up with teams, training, adjustment with primary care centers, families, doctors. We have a 3-step training program for patients that are discharged with the Tidal, because we have like this new generation that they assimilate like anything with easiness, but we have some older ones that can do it too. They just need a little bit more help, so we try to give it to them. So another point, just to finish my comment, is social workers. We need them a lot in Brazil. So we work with them a lot because we have a lot of difficulties for some patients when it comes to accessing internet. So we need like this huge background work to make it happen. But like baby steps, 1 step at a time, we are making it happen. It's very nice to hear our experience and learn from you, so we can do it right when we are at some stage of near to you guys.
No, that's great. Great sharing. Really, really interesting, everything you said. Actually, we are going to move to the next step, but I would like to hear from Dr. Anna what she can share with us in this regard in terms of innovation and technology?
I'm so proud to hear Dr. Rafaela tell us about use case of Title. Twinda Care represents Title Care in Brazil. And Twinda have a mission to connect patients to healthcare providers with security, safety, flexibility. For this, we search what is more disruptive Internet of Things like Title Care and other device that improves customer experience, joy of practicing and care delivery, sustain and scales the healthcare system, and increase the accuracy for care. We know that innovation in healthcare can promote virtual care, digital workflow, automation, and clinical decision support. But it's so important that patients and clinicians must be aware of existing telehealth service through effective digital community for reduced digital outreach. The telehealth solution must to be easy to use and include the ability to connect the text, audio, and video, for example. I'm so proud of Pequeno Príncipe for the project where they will development with Title Care.
Great, fantastic. Actually, now we are talking, I think we are already touching this point of accessibility and how these initiatives and technology now allow organizations to reach out to populations that we didn't have before, either through telehealth or sometimes to inform, provide information in their fingertips. So I would love to hear from you all kinds of innovations and programs and that you have created exactly to expand, leverage technology and leverage programs to expand the accessibility of the population and reach out to populations that you couldn't reach before. SickKids team, any thoughts or sharings on that?
For sure. So, what we've done is, I'll share with you our virtual urgent care program, which is a very exciting program that we launched about 2 years ago, and how through this program we've been able to also expand accessibility of our services to areas that can't access care. So our platform is a first of its kind solution in our state. It's a solution that's essentially an on-demand urgent care service for patients in our region. And the way we came to this idea, it stemmed from, this is probably a problem that is not just within Canada, but across the world. Our emergency department was seeing increasing volumes. We're operating at 30% of our capacity, and this creates many patient safety risks. It creates a lot of dissatisfaction because of the long wait times and the crammed spacing that patients are waiting for. And finally, it's contributing to provider fatigue and burnout because of the amount of patients that they have to see. It's a very overwhelming experience. Coupled with that, because SickKids, we've shared how it's a pediatric hospital. It's one of the only pediatric hospitals in our state, and it's the only one in our region. So we're getting a lot of parents who are visiting for non-urgent visits. In fact, about a third of our volumes are of the non-urgent variety. And the reasons why they're coming in is because of our brand. SickKids is one of the best pediatric hospitals in the world. Also, they're coming for reassurance. Usually they would have even seen a primary care provider and still come to SickKids for reassurance. They're also coming because of access issues. They're trying to see a specialized pediatric service provider, or they're trying to see somebody with pediatric expertise that they do not have access to. So overall, it was like an overwhelmed, inconvenient patient experience. And what we did as a team, we sat down in late 2018, beginning of 2019, and we wanted to really address both the capacity constraints as well as the accessibility issues. And we've designed this really great idea that we've taken to our government in 2019. And through the negotiations, everybody might be aware of how cumbersome sometimes the bureaucracy could be. We've decided to as we were building through it, COVID happened, and as mentioned by a couple of people, it was the greatest assist we could have had with this initiative, because it really accelerated both the need for this, because lockdown, people couldn't go out to see primary care providers. And then on top of that, the desire for virtual care to improve accessibility made having such a solution very attractive for people. So the program, the aim of it was to transform how we deliver emergency care across sick kids by reducing overcrowding, improving wait times, reducing safety risks, and increasing access to people that do not have access to pediatric services. And we expect it to improve both convenience and access. And what we will share some of the kind of outcomes from there, and did do quite a bit of that. The concept was very simple. What we've done is we, on our website, created a symptom checker that once you launch, you as a parent or as a patient would just select a primary symptom based on how you're feeling. And that primary symptom gives you a secondary symptom, a list of secondary symptoms that you get to select from. And this symptom checker was based on Dr. Schmidt's pediatric book of protocol. So it's empirically proven that this branching logic would allow for safe access of, or safe recommendation of care to the person accessing it. So the branching logic based on what you selected would either suggest, yes, maybe you should go to the ED. What you could do is potentially wait, access your primary care provider. And we have a great website called About Kids Health. I'll put the link in the chat. Right now it's down because we've experienced some recent hack. But once it's up, it's available in over 20 languages, including Portuguese. So what we do is we recommend that you wait for primary care, and the self-care, we give you the related article that you can reference so that you can have the information that you need while you wait for a primary care provider. And the last option would be you'd be eligible for a virtual visit. And what we wanted to make sure is that the patients who would be eligible for a virtual visit would be clinically safe to see virtually. And that was mentioned by our colleagues here in Brazil. Like sometimes you need to actually physically examine the patient. There are some conditions that you can safely do virtually and still be comfortable as a care provider to provide a recommendation from there. So with that, we've launched in April 2021, and so far we've seen over 30,000. So the symptom checker has been accessed by over 30,000 people. So that's a huge number of people who would have potentially come to the ED, but we're able to access the symptom checker and potentially divert that visit. And through the system checker, we've also been able to serve about 7,000 virtual visits safely. And in terms of some of the results, 88% of patients said that they felt their concerns were addressed. 92% felt that the next steps were taken care of. And when you include neutral, so we use a 5-point Likert scale. When you include neutral, satisfied, and very satisfied, 95% were very satisfied and said that this felt like the same or better than in-person experience for their purposes. So you can see how something like this could increase access to people across Brazil, because again, you have many different individuals who would need to come to some of the main centers for care, and they do not have the ability to come there because you either have overcrowding, long wait times to see a specialist, potential opportunities to, I know Dr. Fael mentioned the 30 million people in Brazil who don't have access to internet. This could potentially, because of its ease of use, you could potentially, as you increase the number of internet users, use the Teams tool that it uses. So we use Microsoft Teams, which makes it very easy. It requires less data than other platforms. So it's a very user-friendly, safe experience that has increased access of care and has reduced some of the visits that would have potentially come to sick kids. So I'll pause here and see if Greg or Cindy would like to add something before we move on.
Ricardo, we have another use case in our back pocket. We could share it later if we have time, but Raphael, and we'd love to hear more about the innovations that your group was working on as well. Thanks, John.
Fantastic.
Thank you, Greg. I think I've already talked a lot about what we are doing, but I think in terms of accessibility, it's important to point out our initial intention when we started. So we officially started our telehealth program 2 years ago. It's very recent. And we were very worried and we were very focused on targeting patients from the public health system. So our patients lost follow-up during the pandemic and the lockdown. It was very worrisome. So we had like very vulnerable patients that were not being seen. So our volume was more than 80% of the patients that were being seen by telehealth were from the public health system. So we truly believe it. I was very negative in my comments, but we truly believe it that it is possible to do it, but we have to have like the focus in the background to do it with vulnerable populations too. And this has been our focus. And in 2023, we are expanding this focus, but with the lens in the most vulnerable also. So this year we are invested in. It's very interesting to hear you guys talking about your program of emergency care, because this is our focus also in 2023. So maybe we can have a special call later to talk about it. It's very interesting because we also share problems of overall education regarding population. So people have like these really simple doubts, and they are going to the emergency departments and exposing themselves to things that they don't even know, to ask simple questions. So this educational program that you were talking about, or even a simple teleorientation, can be very paradigmatic and like making people understand what is urgent, what is not, and to bringing a shift in culture. You know, I think people need to understand their pediatrician as a routine, right? And they're going to emergency departments to routine consultations, and this is very bad for our hospitals, it's bad for our patients, expose them, make them stress. So we are focusing now in an emergency virtual care also, but also in teleconsultancy. So we have a lot of interesting structures like pediatric ICUs in the Brazilian territory that don't have like specialists in pediatric intensive care. And we have them here, and we can help with our knowledge, and we can help them with information. And we have a lot of literature worldwide saying that if we give information to the health providers that are like presently with the patients, we can impact in mortality and morbidity. So we're now focusing on teleconsultancy for pediatric specialties and ICUs, so we can like make all this expertise accessible. And I know you guys have been reading the news or watching the news, and we are going through a very big humanitarian crisis in Brazil. The indigenous tribes, the Yanomamis, they are a showcase of how we need to make healthcare democratic in our country. It's not. So we are very focused on the North and to bringing our expertise to them, to help them to qualify their professionals to better care for these children. So I think that's it.
Thank you. Dr. Anna, any comments on this?
Yes, I can say about my real case because I have NDA with my clients, but I would like to add a comment to comments with Dr. Rafa. In Brazil, we have three kinds of payers: insured healthcare companies, SUS, that means a unique healthcare environment funded by government, and self-paid assistance. This, in almost time, difficult, the cost, the care access and engagement for all the population of Brazil. We need to have a plan to make a budget of this plan and the structure, and we need the investment on education, on financial care, and promotes family viability for the care access.
Okay, that's fantastic. So I just want to talk to the audience who are watching. You guys can send questions to the chat box. We'll be happy to answer, since we are going to the last 10 minutes of this discussion today. But I would like to bring here as a last part, if you guys can share some lessons learned but also what you expect in the future. What, where is it going? The use of the technology, the virtual care, the ways to educate virtually people. Where do you guys are seeing the future going? And you can even share some gaps that you are seeing that you would like to be fulfilled so you can achieve your future goals. So, Sick Kids team, please share a little bit how you see the future coming.
Thanks. I think a colossal new frontier where it sounds like Pequeno Principi is probably a little further ahead than us in their work with TytoCare is what we refer to as remote patient monitoring or remote care management. Much of what we've done in the virtual care space to date is just taking the visit and digitizing it. So going from that analog world to the digital world, but doing the same thing. What remote care management allows you to do is decouple the care that you're delivering from that unit of the visit. And I think that will really help us transform into a health system that's more sustainable, where we're not just asking for more money and more people all the time, but will allow you to manage patients at home, perhaps follow data asynchronously or in real time. And when data goes outside of trigger ranges, that can then trigger patient care or an intervention. And we're hoping that that will really help us as we redevelop our campus and are going into a lot of construction to can some of the volumes to get kids care closer to home in a more continuous way. So that's something we're really trying to build the foundations for an enterprise-wide scale up of remote patient monitoring in the next couple of years. And just a couple of other quick comments based on what my colleague said earlier. Rafaela mentioned the workflow integration and how important that is. And I just want to underscore that a lot of times when these virtual care solutions get stuck, it's got nothing to do with the technology. It's how we've integrated that into the workflows. And you can't just keep layering on barnacles of new technology for providers. You have to make the right thing to do the easiest thing to do. And that starts with really understanding the workflows and how you can embed technology in that to make things like virtual care easier. A quick mention of cybersecurity. It just has to be top of mind the more that you digitize. You heard John mention we had a massive cybersecurity incident at Sick Kids that started, it ruined a lot of Christmases actually. It was on December 20th. And it's, my goodness, can it send a digitized organization back into the dark ages quickly? We talk about the change management to get everyone into the digital era. There's just as much to go to downtime procedures and back to paper if you have a cyber incident. And then lastly, just again on equity, health equity. Digital technologies can embed inequity if not done right. So with every solution, keeping your eye on the ball, ensuring you can plug into interpreter services, ensuring you're translating materials appropriately, and constantly doing evaluations, cutting those by demographics to understand how your solution is meeting the needs of the various demographics that you might serve. So thanks again for the opportunity to contribute today, and back over to you.
Fantastic. Thank you so much. Okay, so Dr. Rafaela, I would love to hear from you what you're expecting in the future and some gaps that you're seeing.
What I'm hoping for the future is interoperability. I think we need all the solutions to have common ground, and we need like what I expect is that the medical record belongs truly to the patient, that is not like fragmented and something like that. I believe that we are going to have a disruption when we have true interoperability. So, and as a gap, Ricardo, I think a huge gap is education, a huge gap. And I'm not just talking about education in telehealth. I'm talking about overall education. You know, patient education, for them to understand that when we are talking about telehealth, we're not talking about social media. We need to have limits, we need to have boundaries, we need to instigate them to think about better uses, you know, because we are living in a world that we can have everything when we wanted, as we wanted information. We have all the social medias, we have Uber, we have iFood, and we talk a lot about the Uberization of digital and healthcare. So we need to set boundaries, you know, so we need to educate patients, we need to educate health providers. And as a message, I think to finish my comments, it's that what we believe in as an institution, we really believe in healthcare as in telehealth as a way to expand and democratize high qualified knowledge. That's what we need, especially in Brazil. And for that, we believe in alignment with scientific evidence, propedeutics, continuous education once again, and our work aligning technology with the best of human care. So once again, I'm picking up on what Greg just said and John just said earlier. So we need good humans to have good technology and to have good telehealth. So we need to avoid vulnerability bias. We need to avoid social exclusion through technology. So we only can get that with good humans, good doctors. So we still need the humans, you know. I think that's the point. We need the humans. Thank you once again, Ricardo. It was amazing. I learned a lot. It was awesome. Thank you very much.
Fantastic. And Dr. Anna, from a technology perspective, how you see the future, what's coming?
I hope that future brings the access care, independent if will be in telehealth or not, only access care. The technology promotes the right care at the right place and the right time. When designed well, the technologies can be a force multiplier. We can augmenting care teams, reducing time spent on electronic medical records, closing skill gaps, and enabling clinicians to deliver care from anywhere in a more human-centered way. It's important to say, like Greg said before, the telehealth solution must be secure and safe for both providers and patients, must be fast to adapt to the changing needs, for example, the crisis, the pandemic, and the evolving capabilities of the local healthcare workforce. But for those of these works, we need a change. And I want to repeat this. We need a mind change of C-level to invest in infrastructure and training of IT system. How can I talk about promote telehealth if I haven't a stable internet connection, for instance? We need to change the way of work. You cannot still work in silos. We need to work in a centric way. This is my message. Thank you so much for the opportunity. And it's an honor to share this space with these professionals.
Fantastic. Thank you so much, Dr. Anna. Daniela, we are on top of the hour. Actually, we already passed a minute. I don't know if we can address the questions virtually later, or I can pass. We still have 1 minute to pass to the one question to the panelists.
It's up to you, Ricardo. Maybe you can have just one or two questions, just one, maybe.
Well, so I'm going to put a question here is about how your organizations are incorporating metrics and percentage targets in these new initiatives. So the initiatives are new, virtual care, you are seeing progress, but have you already established some metrics? You want X amount of patients accessing through virtual care for this year and for the next year, and this aligning with your overall strategic plan for your organization? Sick Kids team, could you share with us how your organization is adapting to these new initiatives that you are just implementing?
Thanks, and apologies, I have to drop off promptly, but John can give a great rundown on how we're using metrics, both for some of our specific solutions, but how we embed some of our targets in our corporate scorecard as well. So thanks all.
Thank you,
Greg. John.
Fantastic, thank you.
Awesome. So what we've done is we've worked together with our colleagues to identify what is a good benchmark to work towards. And again, like Dr. Faya and Dr. Anna have mentioned, is that we can't force everybody to come in. There's also the inequity piece. So we couldn't expect 100% of the patients to be virtual. So what we've done is we've identified every single department. We worked with them to see what is an appropriate number of ambulatory visits that could be done virtually. And together we aggregated those numbers together into one consolidated figure and figured out what our expected annual ambulatory volumes. And from there, we figured out our percentage target that we want to work towards. So it needed to be very department and procedure specific as well to make sure that it's appropriate from a clinical perspective. And if it's not appropriate from a clinical perspective, people won't adhere to it. And then also we want to make sure that it's equitable to ensure that parents and patients who couldn't access this, couldn't come in virtually, how can we ensure that they had good care? So we want, for example, to ensure that we had physicians available Monday to Monday, every single Monday, for example, to ensure that something that is primarily virtual, something like a service that went virtual is, for example, urology. We had a lot of urology services that went virtual. We want to ensure that there's always somebody available on a specific day so patients could come in if they needed to. And the target that we set was 40% during the pandemic, and we dropped it down to 30% for this year moving forward. So we want to be able to have our 30% of our ambulatory visits completed virtually.
Great, fantastic. Thank you for sharing those great metrics. Dr. Rafaela, Dr. Anna, any comments on metrics and how you guys are incorporating them?
We're aiming towards 10% of overall consultations to be digital in 2023, with an increase to 15 and then 20%. This is our goal, and this is our most wanted metric. And we have like individuals metric for every protocol of telemonitoring that we have. And we are really trying to work with like a BI with business intelligence that is accessible to all. So everyone can see what we are doing, what we have as difficulties. So when we work with primary care centers, we tend to send them like bullets and monthly data so they can be aware of what we are doing, what we're going through, the epidemiology of the patients. And we do it with our telemonitoring also. So the doctors that are seeing the patients, they have all the information, their WhatsApp and their email, so they can be up to date with us and be engaged and in constant communication. So that's it.
Great, fantastic. Dr. Anna, any comments that you are seeing?
Yes, in Twinda is different.
Yes.
When I analyze the use of title care, for example, I observed that in 2021, I had 1,000 virtual consultations concluded. In 2022, this number increases 3 times. My number of 2022 consultations was 3,000 consultations. This is show for me that how can I not how can I that we can reduce the digital outreach. We can promote education and information about technology, and we can improve the telehealth care. We can promote the remote examination. It's so fantastic.
Great. No, fantastic. Thank you so much, Dr. Anna. And I think with that, I want to thank all the panelists here. Thank you so much for your participation. I hope we can do other events like that. And pass to Daniela, who is going to close the event.
Thanks so much, Ricardo. Thank you, everybody, all the panelists here. It was very good to have this kind of conversation and exchange experiences. Please, we are going to have more webinars like this, more meetings. Be connected to our social medias, and then there we will show the date for our next meeting. Thank you so much. Have a great afternoon, a great night here in Brazil, and see you soon. Bye-bye.
Okay, guys.
Thanks, everybody. Bye.
Bye.
Thank you, everybody. Bye-bye.